Are you suffering from a pain behind the shoulder blade? Maybe even it wraps into the chest, or maybe a tightness in between both your shoulder blades? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and this is Dr. Jody Freedman. And today I'm going to talk to you about rib pain and middle back pain and what we would usually do to treat it. Maybe you're curious if we can help that or how we treat it in our office. Now, of course, first we start with a thorough history. We want to understand the source of your pain, when you're experiencing it, what type of pain you're experiencing. Then we'll go into an examination. Now, with pain in between the shoulder blades, there can be a few sources. It could be coming from the spine itself or the muscles that attach into the spine and between the shoulder blade and the spine. It could be coming from the ribs, which attach at the sternum, wrap around and attach into the spine. Or it could be rotator cuff pain, or even it can be neck pain that's referring down into that shoulder blade. So once we figured out the source of that pain, we want to optimize the area. So we might start with some muscle work. Now, both Dr. Freedman and I are trained in a technique called active release technique. This is where we pin and stretch muscles, some of the muscles that attach from the shoulder blade to the neck or from the spine to the shoulder blade. And we're trying to break down that tension and release some of those knots that you might be getting in those muscles. Now, sometimes postural strain from a rounding posture can aggravate, I'll have you lie on your back, can aggravate this condition by causing the chest to round and put tension through the middle back. So we might work on the muscles of the chest as well, or the muscles of the neck itself. Now, sometimes the ribs can actually get irritated or stuck at the front of the sternum. That's when we might choose to use our impulse adjusting tool. And we would use that to get that joint moving a little bit better so it's not contributing to your problem. If you're a candidate for it, we might do a conventional style cracking type adjustment where we do kind of like a bear hug. Then we contact on that rib. I'll have you take a breath in and do a little pulse to try and get that rib moving a little bit better. Or we might use the impulse tool. Have you lie on your stomach. And it's accomplishing the same thing. We're trying to be specific, get it on the area of the rib that's stuck, and increase the motion in there. We can also use the impulse on the spine itself to get the spine moving a little bit better. So it really depends on what your health conditions are, what your preferences are, and what's going on with your specific problem. Now, of course, everyone is a little bit different, and your treatment might look a little bit different than what I showed you here today. We're probably going to give you some homework, like some stretches or ways to set up your workstation or your vehicle so that that's not contributing to your pain and your problem. If you think you're suffering from a rib problem or a middle back problem, we can help. You can book online at willowbrookchiropractic.com. We post regular content on Facebook, Instagram, and YouTube under Willowbrook Chiropractic. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.